Dr. Lyons, it amazes me that you have performed over 3,000 facelift procedures during your extensive career and have been deemed the face doctor among your colleagues. With that said, I would like to educate our viewers about the history and evolution of the facelift procedure. Can you tell us a little bit about that?
Sure, Megan. Let's see, I go back approximately 30 years into the history of the facelift, and it has been an operation in the menu that a plastic surgeon could offer to patients that has changed 180 degrees over the past 30 years. So 30 years ago, we did a skin-only procedure, the one you saw with old movie stars where they looked really tight and pulled. And the reason was we simply made an incision, undermined the skin, and pulled really tight, took skin off, and closed it. And whatever you look like, you look like. And that was a facelift. So you created what I think are these artifacts that looked very facelifted and very unnatural, something that women today do not want to look like. So now, during the course of the past 30 years, plastic surgeons have looked at that result and thought, that's not really that great. Certainly they look better than an older woman, but not as good as a young woman does. And the reason was, we were violating aesthetics by ruining the contours and shapes that produce youth. So if you look at a young face, it has full cheekbones, a nice jawline, nice fullness of the face, a clean neck, and therefore the technique of the course of the past 30 years has changed significantly to address these issues and not just do a procedure that tightens and vectorizes the face. So now we have an operation which is much simpler, much more effective, much better tolerated, more gentle, more elegant, and you actually achieve results that are very natural looking. Now, natural doesn't mean they don't make the patient look younger. It uses the reversal of aging process of the face as opposed to a surgical artifact. So we have deep plane, where we actually went down to the bone, found that that doesn't last any longer and actually looks kind of strange. Then we have the smash technique, which is where we lift lower levels of tissue other than just skin, and that gives a very natural look, allowing us to put volume where we want it as opposed to where the skin wants it. So the smash has been maintained. Other techniques have paid attention to where the hair is, no removal of hair, decreasing the scars, decreasing recovery, and in a general sense making this technique more patient-friendly, but much more natural, more beautiful result to what we have today. In fact, today we have an operation cobbled together, little pieces of what we did in the neck, what we did in the face, what we did in the forehead, what we did in the eyes, so that we took all the great pieces of the old operation, maintained all of those into a routine, an amalgam, if you will, of the good stuff and not the stuff that really make people look strange, and put those together to create a result that really is quite attractive.
So with that said, typically I know that we talked about the evolution of the facelift and the technique that you generally use. Can you talk a little bit about the technique that you find you'd like to...
Well, what I've come down to over all these years, basically one of the ways I define a good plastic surgeon is someone who's never happy with what they did the last day. So it's like a good athlete. You know, a good athlete never walks away from a game thinking, I was perfect. You know, they always walk away thinking, okay, I won, I'm good, I'm in a certain echelon, and that's a good plastic surgeon, but thinking, how could I do it better? So you always change things a little bit. Every time you step up to the table, you change a little bit. Maybe the way you attach the earlobe, maybe the type of incision you make, maybe the way you augment the cheeks, maybe the way you address the jawline. So what I do today is, as I said, an amalgam of what I've learned through the years to be the most effective, direct way to make a woman's or man's face look very youthful, which is moving volume at a deep plane, doing a smash technique, reflecting that with the skin, with a short scar, not involving the hair at all, so patients can still wear their ponytails, can still go on a boat and have the wind blowing their hair. But most importantly, we do this now under local anesthesia, no need for general anesthesia. We do it in the office setting, patients are very comfortable, and the recovery truly is about 3 to 4 days. So one of my patients could wash their hair and go out to dinner with no one knowing she had a face of and looking better in 3 to 4 days. So that's quite a significant change from the procedures that we did through the years. Heading way back, 30 years ago, facelifts took 6 hours. You were in the hospital for a day, you stayed overnight, you couldn't talk for a day. It was a very different procedure than it is today. And we sort of dropped all the pieces of that didn't make any sense and really didn't move things forward. So I think this is one of the best operations we have today in plastic surgery.
Dr. Lyons, thank you for your time, and we look forward to your next video.